Do you want to be a star? Cayman's #1 community station, Bobo 89.1 FM, can help. Bobo 89.1 FM is your voice. If you want a platform to create your own radio show, Bobo is the station for you. We provide the time, support, coaching, and the radio station to make yourself heard. Is it a talk show, music show, self-help, a show for kids, faith, advice, politics, or news? It's your show. It's your voice. Get in contact with Chuck Taylor at ctaylor@dmsbroadcasting.ky or call 745-3375 to schedule an appointment today. And let your voice be heard on Bobo 89.1 FM, Cayman's community station.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of Bobo 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health, because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back to another exciting episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. And today I have with me again, Dr. Stenette Davis. How you doing, Doc?
Thanks for having me.
Excellent. So talking about breaking some of the stigmas of mental health. I know last time you stopped by here, we were talking about mental health awareness and things of that. And so we had such a great review on that. We wanted to bring you back and talk to you about some of the stigmas that go to it. Suicide prevention, things of that nature. Yeah. Give me a little kind of a broad view, and then we'll dive a little bit deeper into it.
All right. So stigma continues to be a big problem in providing mental health care. Persons don't want to be identified as having a mental illness, or they don't want to seek treatment for fear that persons will see them and think that they're being treated for mental health issues. And as you were pointing towards, having a mental illness is the #1 risk factor for having either attempting suicide or completing suicide. Mm-hmm. So to address suicide prevention, stigma definitely has to be something that would need to be addressed.
And when we say stigma, it varies in degree because mental health issues vary in degree. Yeah. So sometimes going to see a doctor could be something as, and I'm not saying it trivial, but could be something as divorce, or it could be something more serious as health issues and wanting to end one's life because you have a terminal illness and things of that nature. So what are some of the factors that we can contribute to these types of things?
Right. So one thing I like to tell persons and tell my clients as well, that if you have any organ in your body, it can function differently or it can not function at all, right? And the brain is just another organ in the body. And if persons start to see it like that, if your kidney wasn't functioning, you would go to the doctor. If your liver wasn't functioning, you would go to the doctor. So you could look at it as, if I'm having these symptoms, it means my brain isn't functioning in the way it's supposed to.
Mm-hmm.
And there is help to get, right? Once you have a brain, as I mentioned before, you can encounter stressors significant enough either immediately or over time that literally changes the way the brain sends information, changes the way the brain produces chemical. And then that is how mental illness actually comes about. The brain is changing the way it's sending signals, or the brain is changing the chemical balance and how signals are transmitted.
Okay, so it could be a varying factors that start the process.
Right. So it could be an immediate stressor. So for example, oftentimes a breakup that is unexpected, or even if it's expected, sudden loss of a family member, financial stressors, major tragedies like even recently hurricane, and we've seen where in the past Hurricane Ivan significantly affected the island. Unexpected, unplanned things like the pandemic. We saw over time how that significantly impacted persons' mental health because no one has been through anything like that. No one knew how to prepare for it mentally, physically, financially. So that became like a global stressor.
Right. And folks, when we're talking about mental health, part of the idea is to have that conversation, to get to talk, to get help, because you are going to find yourself in a valley that you can't climb out on your own. And with that being said, as Dr. Davis said, certain things that you haven't encountered before can raise that stress level, and all of a sudden you're not sleeping well, you're not eating properly, your health is declining, and this can contribute to other bodily health from a mental standpoint. Would that be correct in saying that?
Right. That is correct. The other part of the puzzle is that we look at a two-stage kind of theory. One, you have the genes that put you at risk for mental illness, and there are stressors that can activate or trigger those genes, right? So someone can have genes for mental illness and never show the symptom of mental illness if they don't encounter a stressor significant enough to trigger those genes, right? And when you do careful histories or examinations with clients, oftentimes they will report having other family members who also have symptoms of mental health. But again, because of stigma, sometimes those things are pushed down and family members don't seek mental health treatment, so they're not diagnosed. So oftentimes persons come and say, well, the way my mother behaves, it would look like something is wrong. The way my father behaves, it looks like something is wrong.
But they've never been diagnosed.
And a lot of time it's the stigma, it's the shame. There's some religiosity behind it sometimes as well. God is my healer, so I don't need to go in to any other physician versus the ultimate physician.
That's one of the things I wanted to, if I could just take a little sidebar here. Do you find that because of our region and our, and I don't want to say it as specific, but culturally, it is a little bit harder for West Indians to go in and have that conversation to say, I'm not feeling myself. I'm having a little issue here because, as we talked before, man up and deal with it. Or, as a woman, you can handle this, it's been done before, you can make it. Do you find that a lot with our region here?
So I've practiced both in Jamaica and in Cayman. So I'll speak about those two countries and try not to extrapolate for the wider Caribbean.
Okay.
But I find it's a very similar circumstances where once it comes to any mental health issues, persons are more likely to give it over to God than to seek treatment within a mental health provider. Sometimes there are superstitions about the origin of mental illness, whether it's obvious, some form of witchcraft, and then in Jamaica in particular, I haven't seen it as much in Cayman, to be honest, where persons will go to the healer woman or the obia woman.
Yeah.
I had a client who would have spent the equivalent of 7,000 Cayman dollars going to the healer. And when she had presented, she was broke and couldn't get health care. And that was the most effective treatment that she got for her son, was actually coming to the psychiatrist. But by the time she had reached, she didn't have any money to continue the care, having spent all the money on the healer woman.
On this healer woman and the other factors that are
Exactly.
not tested. They're not by no
Right. So sometimes we try to make partnerships with churches and so on, where we try to make the point that if God works through people, then the physician could be one of the tools that he's using to provide you the care that you need, versus persons just saying, I'm going to pray and it's going to magically fix, versus I have provided these people for you so you can get the healing that you need.
Understandable. And that's a great way of approaching, because some, we grew up under the thing that, the church, the faith heals everything.
Right.
It fixes every problem, but, the reality is it's not going to fix the loan if the bank is coming to take your house, and your body, it's not going to fix your body if your body is breaking down on you. You need food, you need substance, you need real things.
So faith and work.
Yeah, faith and works. It's got to go hand in hand. And I think that is one of the things that I think we as a community have difficulty with. Once again, the stigma of, I'm going to a doctor. They don't say that it's a health care.
Yeah.
It's very specific. I'm going to the doctor. I don't tell you what I'm going to the doctor for, because that will be a stigma on you, how you see me. You're less of a human being. You're not strong. These types of things, whereas a physician is really your help. This is the reason why physicians exist, is to make life better for you.
Yeah.
And I think that is one of the things. So let's reel it in a little bit. Statistics on suicide in Cayman and attempted, because there's a difference between attempted suicide and actual suicide, is there not?
Yeah. And that's a good question, but there are some discussions around suicide that's best not those information presented to the general public.
Okay.
Because of how it may cause anxiety. So the suicide statistics I'll abstain from mentioning.
Okay.
Or methodology about committing suicide, because sometimes those things can cause anxiety in the general population, and persons may think something is much, much more common than it is. But I'll just make a global statement to say, in general, suicide rates tend to be fixed in population. What changes would be the number of suicide attempts, because the more interventional procedures you have, the less likely persons are to attempt. And at an individual level, what we found is that most of the interventions devised so far, what they do is reduce the frequency of attempts.
Okay.
Right. And then when we're looking at reducing the numbers, then we have to think on a more global scale, right? So looking forward, one of the ways to address the core of suicide attempt is very early to get into the schools, have mental health programs where children are taught how to identify their emotions, identify their thoughts, be able to express them to family members or caregivers. So if they need help, they're identified early and can get the intervention they need. And that way they will spend most of their lives functional. And it's less likely that they'll become depressed. It's less likely that they'll have anxiety disorder or have other risk factors for suicide. And we see in Cayman, and I must say, thanks to the Alex Panton Foundation, they're doing good work there where they're presenting emotional literacy programs in school to help children. Even they wouldn't have the vocabulary to say, I'm feeling depressed and losing interest. But they can say, for example, today I'm in a red zone, and a red zone would mean negative emotions. Or how are you feeling today? I'm in a green zone, which would mean positive emotions, but it's to get them in the frame of mind to be able to express how they're feeling without feeling judged. So I think if globally, as in worldwide, we started to go into the level of school, get mental health as part of the curriculum, so persons would grow up understanding what mental illness is, learning not to stigmatize just as much as we're having anti-bullying campaigns,
Right.
mental health campaigns in school, and that way, generationally, those children will become adults who are more understanding of mental health, more sympathetic, and then they can pass on that understanding to their children.
So this is something that by optimization should start very young in schools.
Very early.
So early, so that it's a lifelong taught
Exactly.
expression.
Exactly. So it's like getting a kid and jumping back to the religion thing and having him in church, getting them to grow in church. When they grow up to become Christian, they raise the children as Christian, and then generationally, these things happen. So if we think about it like that, then that's the kind of change that we'd hope for. Get it into school early, they become well-informed adults, well-adjusted adults, then they teach their children how to become well-adjusted.
Is this something that should be taught in all schools?
I would encourage all schools, all levels.
Okay.
Right? So, and of course, you would match the intervention to the development
Of course.
of the kids. So, as we mentioned before, for the younger kids, we could use colors to say what's happening. For younger children, they could point to drawings of a smiley face, a frowny face, an anxious face. And then as they get older, it can be more age appropriate. And I think it's needed for workplaces too.
And I was just about to come to that. One of the things that we find a lot in workplaces is the lack of expression.
Yeah.
And that lack of expression is, if you're having a bad day, how do you express that you're having a bad day?
Yeah.
And you need some. I don't know if me time is the right word, but you need another movement, another outlet away from where you at. If people remember when you first remember seeing things on the internet, I remember, office rage was a thing. People smashing their computers and I was like, why computer? But then it was other things lead to that frustration. So is this something that office place should have some sort of conversation about that also?
Yeah, I think that becomes very important. And in a very funny way, there are some professions, even if you're having a bad day, you have to put on a smiling face for the public, and you must imagine how difficult that would be. Imagine a bank teller. She can't be there like, I'm just having the worst day to the customer.
Right, of course.
She has to keep us certain, and telemarketers and so on. And so those are very stressful jobs, and then persons are expected to perform at peak level. They are praised based on the number of customers they serve, and then they will lose their jobs based on how they're doing there. But there is no provision to say this job is stressful, and because we know that this job is stressful, let us make sure there are provisions in place where you have someone you can talk to, or we'll have regular seminars that will teach and help you how to manage your distress when you're dealing with difficult customers. So, and I think if workplace adopted these models, it would actually be beneficial, because when we look at depression, for example, it's the number one cause of disability worldwide. And I always tell person that's a funny thing, right? It's not physical disability.
Right.
Depression is the leading cause of
and I find that so strange.
Right. And because of that, there are lots of missed days because persons are depressed. And when you have missed days, it means that the business loses out. You have to pay lots of money for treatment. Insurance companies have to pay lots of money. But if we're saying that from very early, the supports are in the workplace so that the workers feel accommodated and supported, then they won't feel so overwhelmed in the workplace. Are there provisions if they pick up signs early, they can actually go to someone. And in the long term, that saves everybody, but it's not being seen like that. The most important thing is get the work done, and then when that worker breaks, then everything falls through.
Everything falls through. I remember one case in the U.S. A couple of years back where literally a person complained that they were I shouldn't say complain, wrong word. A person told the business that they were having some issues and they wanted to seek help.
Mm-hmm.
And the business said that they were complaining and fired them. And I was like, if a worker comes to you and saying, I'm having difficulty, not with the job, but with the scenario of the job, why would a company not want to help them?
Yeah.
You know, now, mind you, now a lot of businesses have changed their models over the years, but a lot of them haven't. How can we kind of let them know that it's okay to be open to this conversation like what we're having today?
Right. So I think this is somewhere where government comes in to some degree to provide legislations to protect workers. So for some institutions, so for example, I work at HSA, and one of the things that they're introducing and starting to practice is what is called just culture, right? So wherever there's a mistake, instead of looking at it in a way to punish the worker, they say, was this a systemic failure? Was this an individual error? And what are the steps we can put in place now to ensure that this error never occurs again?
Okay.
And so it's a way to say, if something goes wrong, let's fix the system. And if it's an individual error, let's get the person the knowledge base necessary to execute the task instead of punishing individual persons. And I think if more companies adopted that model or framework of working, then persons would feel more comfortable in their job. They would feel more secure, and they would feel like they're a part of the company that's just working for a paycheck. Because if you're working knowing that you could go any minute, would you be invested in that organization?
Right. It puts some serious thought on just job security and also people security, because your business is only as good as the people that work for you and with you. Folks, if you're just tuning in, I'm talking to Dr. Davis about some of the issues around mental health and how the stigmas that go with it. We're going to take a break and come right back. You're listening to Healthcare Today with HSA. I'm your host, Chuck Taylor, and we'll be back in a few moments.
Do you want to be a star? Cayman's #1 community station, Bobo 89.1 FM, can help. Bobo 89.1 FM is your voice. If you want a platform to create your own radio show, Bobo is the station for you. We provide the time, support, coaching, and the radio station to make yourself heard. Is it a talk show, music show, self-help, a show for kids, faith, advice, politics, or news? It's your show. It's your voice. Get in contact with Chuck Taylor at ctaylor@dmsbroadcasting.ky or call 745-3375 to schedule an appointment today. And let your voice be heard on Bobo 89.1 FM, Cayman's community station.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of Bobo 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Thank you so much for tuning in. It's another episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we're talking to Dr. Davis about some of the stigma that goes around mental health and what some of those issues lead to. With one of the issues that I was talking about earlier was suicide and suicide prevention and things of that nature. What are some of the groups that have a higher risk for a higher risk of suicide, and attempts? Because as we said, there have slight differences there.
So men generally attempt suicide less, but they're at greater risk for suicide when they attempt because they tend to use more lethal methods, right? And a big part of males being at risk is that they tend to access services less. Either that's because of societal pressure to just be a man and just man up and deal with things, or it's some perceived notion that men don't get mentally ill. So it's kind of a suffer in silence scenario. Teenagers, as part of growing up and trying to develop coping mechanisms, teenagers can have suicidal thoughts. But usually if there's a suicidal thought, the brain thinks, all right, there must be another way. So in a way, there's some function to it when it's not overwhelming. Mm-hmm. But because of the stage of brain development, teenagers are more likely to be impulsive. And they're more likely to attempt suicide about things that persons probably wouldn't attempt in later life. So like bad news, not getting the test result they wanted. Mm-hmm. And generally, as I mentioned, it's a more impulsive time. So teenagers are at risk for more attempts. Fortunately, most times when teenagers attempt, there are not lethal methods. The elderly population are at serious risk. And as we see persons getting older and living longer, loneliness is becoming a significant problem. And the reason why elderly persons are likely to succeed is because they have so many medications. So on average, elderly persons are on like 5 to 10 medications. So you can imagine if they should try to harm themselves.
Yeah, they overdose.
And younger persons, if they try to harm themselves, the body is more resilient, the body is more responsive. So they can be saved, but not so much for the elderly population. And of course, persons with serious illnesses, life-threatening illnesses, and chronic illnesses, and any mental health diagnosis, but especially disorders like depression, bipolar disorder, schizophrenia.
Okay. And you were talking about teens and elder folks living longer. Well, teens being young and elder folks living longer. How does that affect families and communities, suicide and suicide attempts? Tell me a little bit on that side.
Yeah, so what you're saying is exactly right. So a big part of how suicide affects communities is highly dependent on how the media represents the information. So as I said to you before, I'm trying to be very careful,
right,
even how I have this discussion, because sometimes when the media presents a case that happens in the community, expands it beyond what it was, give graphic details.
Okay.
Then what we can have what we call copycats
Okay.
right? So persons who may have not been motivated to carry out these acts might say, all right, let me follow that method, right?
Okay.
In smaller communities like Cayman, one person tend to be connected to 5,000, and then persons are individually affected because they're saying, I've heard about it, but this is somebody that I know. And then persons start to look at their own life and think about if they would do it and explore their own mental health challenges.
And I want to say, because we are so small, things like attempts and suicide completed
Yeah,
ravishes through our community in a matter of hours.
it does.
You know,
It does.
details and you know, oh, so and so was having a bad time and rough, and they did this, and does that put a lot of pressure?
It does. And that's why I'm saying having mental health support in schools, very important for that reason. And there something like that happened recently, and I won't give any specifics.
Mm-hmm.
And we saw an influx of children coming in speaking particularly about that incident.
Right.
The school counselors were flooded with persons who before never expressed what they were going through. But then that situation again got persons to evaluate their own mental health and say, maybe I need to go and make sure. So I think it's very important that the schools have counselors, right? And if anyone in the government is listening, I will put a plea that all schools should have clinical psychologists, right? The schools tend to have educational psychologists and counselors. But I think every single school in Cayman could benefit from having at least one clinical psychologist. Or maybe if they could come and sit and have a discussion with us and just explore what are the mental health challenges in the schools so that we can have the supports we need in place.
But I would say that needs to be done before we have an incident.
Yeah.
Because 99% of times you hear about things after the fact. And you never hear, well, leading up to it, we took these types of precautions. We had these types of meeting. We talked about how some of the trials and tribulations of growing up. As we said, we're coming out of a pandemic into, we just had hurricane season. Everybody was up in arms about that and still in it. And so these things are part of our constant regime now.
Yeah.
And if I'm feeling pressure as an adult, imagine a child, a 12, 10, 15-year-old.
Yeah.
What kind of pressure can they be under?
Yeah, and that's just exactly it. Because most parents are not equipped to speak to children about mental health issues, right? And there is a danger if you're not equipped and you're trying to communicate with your children or any younger person about mental health issues, you will speak to them from your own personal beliefs. And again, it goes back to, well, what is your belief?
Mm-hmm.
And lots of times things will get just tough it out. You're strong. You can do this. And God will take care of it. And it goes back to, all right, but the core needs, are they being addressed? Are they being met? And so where individuals like parents, adults cannot do that, then we need benefits of having counselors and psychologists who can provide that kind of support to our children where it can help them process emotions and process trauma.
Okay. And what would you consider some of the warning signs? I mean, parents and teachers kind of are the first tier of information. They see the change in behavior.
Yeah.
They see those things. At what point should they escalate it to say, come to a professional? Hey, I think I'm having a child that we need some help here. What are some of the signs that they can look for?
All right, so at the level of the school, and again, it depends on the age group. Teenagers are better at masking symptoms, right? But in younger children, usually a change in personality is one of the things that you look for. Previously vivacious kid becomes very quiet. Our previously quiet kid becomes very talkative, is getting in trouble, is not doing homework, grades start to fall. suddenly the kid used to love school, they don't want to come to school anymore. And so those personality changes tend to be what is observed in the school setting. At home, becoming withdrawn, so the kid just goes, stays in his room, doesn't interact or stay in her room, not sleeping as much as they used to. But now with devices, it becomes very difficult to know what's happening because sometimes the kid just literally plugs themselves into the device and they're on the device all the time. And if you're not vigilant to say, well, this is different, then it will be missed. But again, if you're not sure, the best thing is to say, I think this is happening. I'm not sure. If you're a teacher or so on, I would like you to speak to the counselor.
Right.
But it means before that, the teacher has to have the kind of relationship where students would be comfortable in taking directions and instruction from them. So that's something that I would encourage teachers to look at. If they're fostering relationship with every student, that they could identify if there are changes. And if they do identify changes, would that student be comfortable taking a recommendation from them? Like, maybe you could benefit from seeing the counselor. And of course, similar thing with parents. And that parents would be willing, if they see signs in their child, to get the help that they need.
And that, I think that is kind of the starting point, is the parent and the teacher being comfortable to have that initial conversation with the child, and it doesn't make it worse. Because, I'm a firm believer in, if you have that talk, it should be a talk for the better, not to say, oh, well, you're doing this wrong. Why are you doing this? It should be, hey, what's going on? Talk to me.
Help me to understand.
Help me to understand what's happening in your world. Because I think, we as adults get removed. We're pulled in, 20 different ways. So we assume our household is always fine. Yeah, like lights are on, food's in the fridge, everything is good. Everything is good. And that's not the case. And most times, there's always underlying factors that are in the household that you probably don't even know.
Yeah.
So with that being said, how can we help prevent these things from coming up? You said, being able to talk to the child, being able to have that connection. Can we expand that into workplace and things of that nature also?
All right. So in terms of at the level of the household, and sometimes it's very difficult because every household has a different reality. You may have a single parent who has to do 2 jobs, and so they literally only see the kid when the kid is asleep, or only sees the kid when the kid is getting ready for school. And then how do you tell that parent to be more attentive? Because if she doesn't work, then nothing can be provided. But what I would say, where parents have the opportunity to interact with their children, choose that over other interactions, right? So in a common space, everybody has a device now. And it's easy to just go on your phone, spend time on WhatsApp, play game, Facebook. And it's just as easy for the kid to play a game. But if you don't interact with the kid or talk to the kid, then you would not develop a relationship. And if you develop a relationship, then if you're in a relationship of any sort with anyone, you would expect them to act a certain way. So when the person changes the way or they're operating, then you can say something is different. And even if you don't know what that different thing is, at least you can have a conversation to say, this is how we usually operate. These are the differences I see. Could you help me to understand why these differences are occurring? The person doesn't want to talk because, especially in teenage years, the reverence that they would have for parents when they were children is gone because they just like all the glitter and glamour of a parent goes in teenage years. Like, oh, this is just an adult struggling.
Right.
And so they might not trust them for whatever reason. And then maybe you can say, all right, let's see if we can talk to somebody who you'd feel comfortable talking to. And similar thing in the workplace. I've done presentations before working in mental health, and then I just pause to ask my own colleagues a very awkward question. If someone in this room, one of your colleagues was mentally ill now, would you feel comfortable going to them and say, I think something is wrong?
Okay.
right? And I think that is something that is very difficult for people to do in any setting. So you can imagine in your workplace if you see a colleague not functioning and if you don't have that level of friendship, then how do you go to that person and say, I think you need some mental health help? you know?
Right, and not be rude and condescending
Exactly.
with it, because they may take it as an act of being aggressive.
Yeah. So again, it goes back to workplace culture. If there are supervisors listening, would be best that persons have at least a civil, casual ways of interacting. So if somebody changes the way that they're interacting, instead of saying, I think you have a mental illness, you could say, oh, you're used to interact with me this way, but I notice you're no longer doing these things. Is everything okay? The person has the option to lie or tell you the truth. But at least you would have introduced the possibility of a conversation. And that's the starting point.
Okay. I think once again, office culture and home culture are so different, and somebody may recognize the need for mental intervention in homes quicker than they do in an office setting. I've seen offices that have, hey, come and talk to me once a month. The boss will be proactive. Hey, something you need, my door is open on Friday, the last Fridays of the month. We get together, come on in, close the door, and we can have that conversation. I think people are more ample to hear it from the person signing the checks rather than a coworker. Even though a coworker may be the person that see it quicker, they may see a breakdown there. The communication may not, the words may not be able to come out at that point. So the boss will be like, hey, you know what? You were a little short this last month. What's going on? Well, I'm having this issue. Well, I think we should get you some help.
I'll expand it a little bit beyond that. And so there are some companies who are extremely profitable, and their workers barely benefit from them being profitable. And I see where employers who provide good insurance coverage for their clients tend to get very good mental health support, because a lot of the times you will get some insurance package that will say, we'll provide $25 for a psychiatry visit, and a psychiatry visit is probably like $150. And if you need a psychologist visit, it would be like 100 plus per visit.
Okay.
And if you are going to a psychologist, there's no way it can only be one visit. So then you have this worker who is struggling, wants to work, but because of their difficulty, they cannot navigate the work setting, and they cannot get the health care that they need.
And that's the reality.
And that's a reality. So for very profitable companies, I would implore them to provide good health insurance packages for their clients that cover mental health services. And maybe that's something, again, at a governmental and legislative level that they have to look at, about insurance companies not providing support for mental health services.
Because it is part of your health.
Yeah. And then children, adults, everybody across the age spectrum would be able to access mental health care.
Understandable. Some of the, not that we brought up local companies and local ideas, help me with some local resources persons can reach out to if they're feeling this way, or they have suicidal thoughts, or they have some sort of capacity where they're feeling that mental strain and mental drama coming in.
All right, so I would start definitely with my institution, Health Services Authority. So if persons are having suicidal thoughts, especially if they're contemplating, the best thing to do is come to the accident and emergency department at Georgetown Hospital. There's always a psychiatrist on call, and there are always doctors in the emergency room. So the emergency physician would provide the initial assessment, assess for suicide risk, and then determination will be made if the person is safe to go home and be monitored by a family member, or if the psychiatrist needs to see them right away, right? Sometimes persons are at serious risk for suicide, but they don't want to be admitted. And sometimes psychiatrists have to say, based on everything, we wouldn't want you to kill yourself. Admit the person, get them treated, and at the end, when they're not in that distress state, they're like, oh, wow.
So let me just jump right in there 1 second, Doc. So I'm at home with, my brother, my cousin, and they're like, man, I just feel like I don't want to live anymore. I want to die. I really, you hear these words, people toss those around. Oh, I want to kill myself.
Never assume they're joking.
Right. Never. That's what I want to say. How do you tell, oh, well, he's just having bad. He just never take it.
You don't have to assume. Get them the help. And then if the professionals see them and think this is not serious, then you can take it from there. But if someone is ever uttering, I want to kill myself, it must indicate some form of distress, and that's the only thing they can think to say.
Yeah, they're not just crying to cry.
Exactly.
For you to be uttering this out loud, and even sometimes it could be silent, as you said, but for them to take it to that level, assume that they are very serious.
Assume that they're very serious. If anyone utters those words, it means they're very distressed, and that's the first thing they can think to say.
That they can think to say. And then once we get them into the professional at emergency
right. So once they're seen by an emergency physician who may refer them to the psychiatrist, and then the evaluation is made, can this person be managed in the community if they have supervisions? Is it more serious where they need safeguarding and admission is best? Do they need medications? And inadvertently, they would need some psychological support. And we have psychologists at HSA. We do partner with private providers. So if our providers aren't able to see them immediately, then we can refer them to private entities on island. And so we do collaborate. So it's not just we're saying, all right, you have to come to HSA and wait to be seen at HSA. Mm-hmm. We look at what the need is. We look at the urgency. And if we don't have a provider who is able to care for the client right away, then we look at our trusted private providers, and then we'll even call persons beforehand and saying, this is the situation. Can you see this person urgently? And we have a very good relationship with a lot of our private providers.
Understand.
There is the mental health helpline as well. So if persons are having mental health crisis, they can contact the mental health helpline and they can route them where they need to go. And again, there's always a mental health specialist on call every single day. Public holiday, storm, you name it. There's always a psychiatrist on call that can deal with a mental health crisis.
Okay, understandable. So in wrapping up, Doc, I want to say, if someone's out there just listening to us and they feel that life's overwhelming, they feel the pressures of just moving, pressures of being here, pressures of life coming at them, definitely reach out, talk to somebody. Yeah. I think that is one of the things that we you said suffer in silence. I think that is one of Cayman's scariest things, is that we're an island that we talk a lot, but some things are kind of taboo, very quiet. Oh, I don't want to talk about this. I think, this is a great opportunity for us to be honest and have that conversation and reach out to HSA and to the mental health helpline.
Right. And for other matters not related to suicide, but if you're having mental health concern, anxiety, depression, and so on, then there's also the counseling center, which is a service provided by the government, completely free. It doesn't matter if you're a Caymanian, if you're a resident, if you're illegal, they provide services for free for everybody on the island, and you can contact them via telephone. If you're unable to visit, they do online consultations. So I think that is something commendable as well that the government provides for its citizens.
All right. Thank you so much, Doc. Don't be a stranger, and thank you so much again.
All right. Thank you for having me. Have a good day.
Once again, folks, you're listening to Healthcare Today with HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and have this conversation. Take care. Be good to each other. We'll talk to you soon. The Cayman Islands Health Services Authority's General Practice and Public Health Clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of Bobo 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health, because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you want to be a star? Cayman's #1 community station, Bobo 89.1 FM, can help. Bobo 89.1 FM is your voice. If you want a platform to create your own radio show, Bobo is the station for you. We provide the time, support, coaching, and the radio station to make yourself heard. Is it a talk show, music show, self-help, a show for kids, faith, advice, politics, or news? It's your show. It's your voice. Get in contact with Chuck Taylor at ctaylor@dmsbroadcasting.ky or call 745-3375 to schedule an appointment today. And let your voice be heard on Bobo 89.1 FM, Cayman's community station.